we're going to talk about massage and body work and the benefits in your wellness routine. So, most of us, when we think about massage, we think about spas, we think about relaxation, we think about, you know, the normal things that we see massage as a way to relax and check out. And it's great for that too, but that's also one of the reasons that it's great medically. Now, let's see if I can get. Yay! So, in medical massage, what we talk about there is reducing pain release, improves your muscle recovery. So after an injury, a lot of the clients and patients that I see are referred by physical therapists, and I work in conjunction with their physical therapy routine to help reduce scar tissue, help direct the flow of the collagen fibers to better repair and keep mobility of the muscle, so that we're getting directive care that way. With the headaches that are up there, I'm also a neuromuscular therapist. I practice NMT. Honestly, it was one of the original things that I became certified. I've been practicing, you know, honestly, between combat medicine and this type of medicine, I've been in the medical field for the better part of 30 years, but I've only been practicing for the last 15 or so. But neuromuscular therapy was one of the first things that I learned. And there is a routine in neuromuscular therapy that can help manage migraines and other types of headaches. Most people know about migraines. Most people are misinformed about migraines and feel that it's a neurological issue. You know, less than 10% of all migraines are neurological. The other 90% are muscular or disalignment related. And they can be repaired through body work and massage. Fibromyalgia. The cool thing about fibromyalgia is that we now can test for it. You know, it's on a waiting list and it takes a while, but there are testing for it. For many, many years, fibromyalgia was considered the issue that nobody could really say you had or not have because of its issues. But working with it, fibromyalgia, one of the other techniques that I use is myofascial release, and that helps to keep your body more mobile. It helps keep your connective tissue between your skin and your muscles and other places more mobile so that your body works more complete. When I talk about myofascial work, it's kind of like wearing a shirt that's too small for you when your fascia is compressed. Right? So you're walking around and yeah, it fits, but you're not moving right. But if you throw a shirt that's a size too big for you on, you have all that flow and movement. And when you release the fascia in that way, you have that kind of movement in your body, and it gives you more opportunity to move, expand, breathe, do all the things that you want to do in life. And post-surgery recovery follows along what we're already talking about with moving our body and using massage to help the muscles repair and stay fluid and not develop scar tissue during the repair process. Stress reduction. We started out with, most people see massage as stress reduction, but if you have anxiety, if you have tactile issues where you can become extremely sensitive to touch or things like that, massage can work in many ways. It helps to lower your cortisol levels. It will help to brings personal well-being, which inevitably helps you control mental stress and things of that nature. I know I'm talking really fast, and I should probably slow down, but I get excited. I get excited for a number of reasons. I really actually am passionate about what I do. You know, I want to be able to help as many people as possible in life. And my big frustration in life is that we live in a world where most people can get everything in the world paid for in one way or another via insurance or other ways. But if you want this kind of work, it has to come out of your pocket, or you have to have a really good insurance plan or HSA. So it's a frustration because I charge what I'm worth. but that limits the amount of, the whole system limits the amount of folks that you can get to see. And so I get excited and I'm passionate, and one day I hope that the world will be able to have this work done just because they want to have it done. You know? So lymphatic drainage. Everybody knows that we have a lymph system. Not everybody understands their lymph system. Your cardiac system and your lymph system are very similar. They're closed systems within your body that move fluids around your body. Your cardiac system moves blood and oxygenates the cell, and then the sewage treatment plant, or your lymph system, moves waste out of your body, solid waste. Your heart is a pump for your cardiovascular system, so it's constantly moving. I go to sleep, I'm moving blood. I walk around for any reason, I'm moving blood. I simply exist, I'm moving blood. I'm sitting still, not moving, not exercising, not in a situation where I'm not able to move, my lymph sits still. And there's nothing that and it's just not moving, because our muscle contractions are the pumps that help move our lymph and help expel the waste from our body. So when you're in a situation where you can't be active enough to move your lymph, massage can, one, help you return to a level of activity that you make yourself sufficient, and two, it acts as a secondary movement as we're moving the muscles and working, moving the muscles and when working to move the lymph out of our body. My 8-year-old son, it drives me insane, but my 8-year-old son jumps around like a crazy boy while he's playing the limited amount of time we allow him to play video games. And he jumps and he moves and he moves and he jumps. And my parent brain wants to go, sit down, but my therapist brain goes, you keep moving that lymph, get that lymph pumped out of you. You know, that's another thing that we do as a society. We tell our children to sit down and be quiet, and inevitably we're compromising their immune system by not allowing them to move their lymph. You know? Okay, it's mobility and flexibility. It's like everything, you know, if you stretch, you're going to stretch more. If you get massage, your muscles are going to be able to move more. There's somebody in this room right now who came to me as a client with extreme mobility issues, especially head, shoulder, neck. You know, and they have said on this live stream already about how working with me, they came to see me once a week, and working with me, they improved so that now they can crawl around the room and be all stealthy and have that type of mobility. When they first came here to be a part of this, they did not have the mobility to do what we're witnessing happen right now. Thank you for allowing me to use you.
Love you too.
There was one other thing that I noticed on there that I didn't cover that I want to talk about. In this field, there are practitioners that are extremely good at what's called structural analysis. You know, they're able to look at you and they're able to tell what's pulling, what's stretching, what's moving, what's in alignment, what's out of alignment. One of my mentors was really good at that, and I dabble in it, but I would never call myself an expert at that. But the things that I learned in there is that one of the things that can set massage apart is with somebody who does structural analysis. And one of the things that I do in my practice, if you come to me with lower back pain, all right, everybody talks about their sciatic pain. I don't think there's anybody sitting in this room except for maybe the children that haven't experienced lower back pain in their life. Go to a massage therapist and you say, oh, my back hurts. Right? And they rub oil on your back and they do the work back here, but they leave these muscles alone. Right? Hip. Second largest muscle in the body right here is rectus femoris, runs up the front of your leg. Largest muscle in your body is right here. It's a little bigger on me than some people. And right here, and it's called the gluteus maximus. Right? Both attached to the hip. Both attached to the sciatic joint. All right, and so this group of muscles are responsible quite often for much of your lower back pain. Right, and you'll go and you'll get work done with structural analysis and people moving directionally. I know that if I work in front of your legs and I work in a direction to help allow the hip tilt to move back, it's going to stop stretching the muscles in the back, which are being pulled out of alignment because you're being pulled forward. Release one, relax the other, in order to get complete care. You know, we are all balanced. We are a binary. We are a binary world full of ones and zeros. You know, and a negative pole and a positive pole. And I believe wholly in balance. And if you're really looking at true wellness in a practitioner, you need somebody who's willing to do the work on both sides, not one. And to work to find you balance in the movement and balance in the way that you act. You know, someone who's willing to listen, someone who's willing to actually work someone who actually is going to work to lose you as a client. At the end of the day, that is one of the most frustrating things about the business model in wellness. Because the business model in wellness is, to me, make you better. And if I make you better, that means that I lost that income. And I would rather lose that income and have you walk out of here a better person than to keep having you coming back and not fix anything for you. And I think that's one thing that we should look at in this, is find a practitioner who's willing to help you not need them. Kind of covers the holistic where we are. In a holistic approach, here at the center, we have a bunch of different practitioners here. We have energy practitioners, we have chiropractors, we have massage therapists, and herbalists that are willing to bring a number of different things here so that you can have a complete care. I believe that. I believe that a pure holistic approach is your family doctor, your chiropractor, your massage or physical activity therapist, however that may be, you know, and then at a greater level. I also practice TCM, but I practice it using stylus acupuncture and acupressure, as opposed to actually inserting needles or using that type of work. And all of those are important. You need a complete. It's not just one size fits all. It's kind of like on the Western medicine side. In my lifetime, I'm 59 years old. In my lifetime, I went from the doctor who delivered you and buried you to a doctor for everything that you need done. You know, there's a specialist for that. There's a guy for that. Well, in this world, it's that way too. I'm limited by what I know and what I'm able to bring to you, but I can introduce you to a chiropractor who has done work on me, who I trust to work with me and my family. I can introduce you to an acupuncturist. Well, I can't in this area, I apologize. But in other areas that I've lived and worked, I would be able to introduce you to an acupuncturist who I've done work on me, who I was willing to trust and share. You know, it has to be a more complete approach. It's not a one size fits all, and it's not a one practitioner fits all. Again, you have to be willing to lose the income to heal the patient, and that is where I stand on that. There is more to science than simply the pills you can buy at the drugstore. We are all balanced. We are a binary. We are a binary world full of ones and zeros. And if you're really looking at true wellness in a practitioner, you need somebody who's willing to do the work on both sides, not one. Someone who's willing to listen. Someone who's willing to actually work to someone who actually is willing to work to lose you as a client. And so I get excited and passionate. I hope that the world will be